In the name of Allah, the most beneficent, the most merciful. Bismillahir Rahmanir Rahim. Assalamu alaikum, dear viewers. Hope you will be fine. Please subscribe my YouTube channel. Here is the title of my presentation: Recent Emerging Role of Vitamin D in the Treatment of Metabolic Diseases. I am Dr. Abdul Malik, Assistant Professor, PhD Pharmacology, College of Pharmacy, University of Sargodha. Here is the list of contents about metabolic syndrome and vitamin D. Here is the metabolic syndrome. Metabolic syndrome has a cluster of metabolic disorders. Include at least 3 symptoms should be there, including insulin resistance, visceral obesity, hypertension, high triglycerides, low HDL cholesterol, high density cholesterol. Type 2 diabetes mellitus. Type 2 diabetes mellitus is one of the main non-communicable diseases, metabolic diseases. There is accumulating evidence that suggests that altered vitamin D and calcium homeostasis may play a role in the development of type 2 diabetes. Result from small clinical trials and post hoc analysis of the larger trials on the effect of vitamin D supplementation with or without calcium on glucose homeostasis have been inconsistent. It is estimated that 366 million people had diabetes in 2011, and that by 2030 this may rise well above 500 million cases. So, prevalence of diabetes in Pakistan. The prevalence in 1995, Pakistan was in 8th position, 4.3. Now will be in 2025 and will be in 4th position after India, China and US. 14.5 million people will be in diabetes in Pakistan. Introduction of vitamin D. Vitamin D has also been known as anti-rickets factor or sunshine vitamin, mineral and bone growth. Vitamin D is actually more like a hormone than a vitamin, a substance that is required from the diet. Sunlight exposure is the primary source of vitamin D for most people, while sunshine screen inhibits its absorption. Solar ultraviolet B radiation, UVB wavelength of 290 to 315 nanometers, stimulate the production of vitamin D3 from dehydrocholesterol 7 DHC in the epidermis of the skin. Most cells in the body have been found to have receptors for vitamin D. It is therefore now seen as an important nutrient in preventing many metabolic or chronic diseases. Here is the prevalence of vitamin D deficiency is considered to be a global health problem. In 2008, it was estimated that over 1 billion individuals have vitamin D deficiency. 25-hydroxyvitamin D less than 20 nanogram per ml. In Pakistan, vitamin D deficiency is over 50%. But that is too dangerous. Serum vitamin D levels into 3 categories can be divided into 3 categories. Class 1 less than or equal to 20 nanogram per ml vitamin D deficient. Class 2 21 to 29 nanogram per ml vitamin D insufficient, and class 3 greater than or equal to 30 nanogram per ml vitamin D sufficient. So you can see with the help of this figure. Vitamin D sun exposure guide, how people should take the vitamin D from the sun. Here are some fair-skinned people should take sunshine in summer 10 minutes, in spring or autumn 20 minutes, and winter 30 minutes. In medium-skinned people, summer 50 minutes, and in spring 100 minutes, and in winter 150 minutes. In dark-skinned people, in summer 100 minutes, and in spring or autumn 200 minutes, and in winter 300 minutes. So there is a difference in time duration of vitamin D. So, how vitamin D synthesis and conversion is taken in the body? UVB, as I have explained earlier, that is taken from the skin, that converts dehydrocholesterol in the skin to cholecalciferol, and diet and supplements also provide ergocalciferol vitamin D2 and cholecalciferol vitamin D3 that has been converted into liver into calcidiol, in which 25 hydroxycholecalciferol is there. That is not active form. That is also converted into kidney. Again, hydroxy group is attached. That is 125 dihydroxycholecalciferol that we called calcitriol. That is active form. Another product is also synthesized that is not active, 24 and 25 dihydroxycholecalciferol. So calcitriol or 125 dihydroxycholecalciferol, that is vitamin D3, that increases intestinal absorption of calcium, bone resorption, and decreases renal calcium phosphate excretion. That is beneficial in body and kidneys and other parts of the body. Vitamin D conversion and receptors. How vitamin D is converted and receptors are present in the body, in which tissues these are present. Conversion of vitamin D to its active form occurs in the kidneys. This is very essential, but it can also occur in the skin, prostate gland, brain, pancreas, adipose tissue, skeletal muscle, heart, colon, monocyte, macrophages, and in neoplastic tissues. Neoplastic tissues. In most cells and tissues of the body, wide range of biological actions are shown, inhibiting cellular proliferation and inducing terminal differentiation, inhibiting angiogenesis, stimulating insulin secretion, inhibiting angiogenesis, stimulating insulin production, inhibiting renin production, and stimulating production of compounds that kill bacteria, stimulate its own degradation. So multiple things are there. Vitamin D and chronic metabolic diseases. 125 dihydroxycholecalciferol or vitamin D plays an important role in regulating calcium and phosphate metabolism for bone health, autoimmune diseases. This is very important. Atopic dermatitis, cardiovascular diseases, chronic respiratory diseases, Crohn's disease and inflammatory bowel diseases, diabetes type 1 and type 2, kidney diseases, osteoarthritis, periodontal diseases, rheumatoid arthritis, skin disorders, some cancers, infectious diseases, schizophrenia, and depression. These are the some diseases in which vitamin D is essential, can be used essentially. Association of vitamin D deficiency with obesity and diabetes, vitamin D and cardiometabolic disorders. Recent data suggests a connection between vitamin D levels and cardiometabolic diseases, in which obesity, impaired glucose tolerance, type 2 diabetes mellitus. Vitamin D deficiency is associated with a greater risk of obesity and type 2 diabetes. And increased body fat and obesity are associated with low circulating 25 hydroxy vitamin D levels. Obesity is a wide world epidemic, increasing the risk of type 2 diabetes. Glucose homeostasis and insulin release mechanisms could be influenced by vitamin D endocrine system. Vitamin D and diabetes, there is a mechanistic support that vitamin D may influence both insulin secretions, insulin sensitivity, and subsequently type 2 diabetes incidence. Presence of vitamin D receptors, VDRs, on pancreatic cells, the expression of 1-hydroxylase enzyme in pancreatic cells, which catalyzes the conversion of 25-hydroxy to 125 dihydroxy vitamin D3 into active form, is also present in the pancreas. The presence of a vitamin D response element in the human insulin gene promoter and presence of VDR in the skeletal muscles also indicate the importance of vitamin D in diabetes. In addition, directly activate transcription of the human insulin receptor gene, activates peroxisome proliferator activator receptors PPAR gamma, stimulates the expression of insulin receptors and enhances insulin mediated glucose transports in different skeletal muscle and adipose tissue and other parts of the body. So here is the effect of the vitamin D on different organs, as I have already explained about these organs, how it is activated in the body into active form, and some diet and sunlight also provide, and those are converted from liver and kidneys and some other organs, and also help in working different organs properly. So pathogenic link between vitamin D deficiency, obesity and diabetes, insulin level and vitamin D. The link is shown in this figure, in which concentration between fasting insulin, 2-hour OGTT, oral glucose tolerance test, and insulin levels are shown here. In the study, it also linked vitamin D deficiency in obesity and diabetes. Pathogenic link between vitamin D deficiency, obesity and diabetes. Vitamin D deficiency, a risk factor for obesity and type 2 diabetes. Numerous studies investigated the relationship between 25-dihydroxy vitamin D and insulin levels when animals who were induced with diabetes mellitus were treated with vitamin D. Progression of diabetes was slowed down. This is a very important effect in type 1 diabetes, also in type 2 diabetes. Lack of vitamin D may cause a greater level of glycemia and thus carries a high risk of type 2 diabetes mellitus. Low plasma 25-hydroxy vitamin D concentration are seen with increase in visceral obesity in South Asian peoples. Visceral obesity, hypertriglyceridemia, and metabolic syndrome were found to be associated with vitamin D deficiency in children also too. Pathogenic link between vitamin D deficiency, obesity, and diabetes. High doses of vitamin D in food consumed by risk group children are able to reduce the incidence of diabetes. There is a link between 25-hydroxy vitamin D levels and insulin responsiveness of tissues, as well as between glucose levels and glycosylated hemoglobin (HbA1c) in people without type 2 diabetes. The most pronounced effect of vitamin D deficiency are reduced insulin release in people with normal weight, low tissue insulin sensitivity, and overweight or obese people. These are the two major pronounced effects of vitamin D deficiency have been shown. Vitamin D deficiency effect on glucose homeostasis. Study is conducted. That is study by Talai et al. Evaluated the effect of vitamin D supplementation on insulin resistant and type 2 diabetes. The study data showed significant improvements in serum, fasting blood sugar level, insulin, and HOMA-IR after treatment with vitamin D. The study results suggested that vitamin D supplementation can reduce insulin resistance in type 2 diabetes. So here is the table that explains the effectiveness of vitamin D deficiency on glucose homeostasis. So multiple people before and after study was checked. Fasting blood sugar level, milligram per deciliter, insulin level, microliter unit per ml, and HOMA-IR have been checked in different vitamin D group peoples. So you can see from this metabolic syndrome, diabetology and metabolic syndrome journal 2013. So vitamin D deficiency effect on glucose homeostasis. A meaningful reduction is seen after supplementation with vitamin D. Table 3 is final one. Comparison of biochemical characteristics, mean plus standard deviation in patients with diabetes type 2 before and after treatment with vitamin D for 8 weeks. At least 2 months were taken, and fasting blood glucose milligram per deciliter and fasting blood glucose in millimole per liter, insulin level microliter unit per ml, HOMA-IR and 25 hydroxy vitamin D in nanogram per ml and in nanomole per liter is shown before treatment and after treatment, and p-value is given. What is the significance of this study, and significant result have been shown. Vitamin D deficiency effect on glucose homeostasis. Vitamin D supplementation significantly decreased serum fasting blood glucose, plasma glucose, insulin and HOMA-IR in patients with type 2 diabetes. This is the conclusion. There was an inverse relation between the final fasting plasma glucose and basal 25 hydroxy vitamin D concentration. The effects of vitamin D on insulin resistance were significant when vitamin D concentration was 40 to 60 nanogram per ml. You can see in 200 to 150 nanomole per liter. In lower and upper vitamin D concentration, there was no effect on insulin resistance. Insulin resistance appeared to be decreased in type 2 diabetes patients who had received vitamin D. This is important result. Vitamin D can improve diabetes control, and it is recommended that vitamin D supplementation should be included in the treatment of type 2 diabetes. Clinical evidence: vitamin D supplementation in obesity and type 2 diabetic patients. Rationale: according to recent data, there may be a connection between vitamin D levels and obesity and diabetes. Though mechanism is unclear, vitamin D deficiency is associated with a greater risk of these pathological conditions. Vitamin D receptors VDR and 1-alpha hydroxylase enzyme catalyze the conversion of calcidiol 25 hydroxy vitamin D to calcitriol 125 dihydroxy cholecalciferol, that is converted into active form. This indicates the vitamin D's potential role in regulation of numerous metabolic processes. Furthermore, an increased body fat and obesity is associated with low circulating 25 hydroxy level, vitamin D level. Vitamin D treatment in diabetes type 1 slows the progression of diabetes. Food fortified with high dose vitamin D consumed by risk group population may help decreasing the incidence of diabetes. Here is the summary, and we have also checked the important role of vitamin D in coronavirus, that is activates the immune system and help the people to defeat the coronavirus. Here is the summary: obesity is a global epidemic and a risk factor for type 2 diabetes, and vitamin D endocrine system could be involved in glucose homeostasis and insulin release mechanisms. Vitamin D levels negatively correlate with HbA1c and insulin release mechanisms, implying that obese subjects with low vitamin D status may be at increased risk of developing impaired glucose metabolism. So there is multiple chances of diabetes from obesity if vitamin D level is not being corrected. Vitamin D deficiency has been associated with obesity, visceral obesity, hypertriglyceridemia, and metabolic syndrome. These are also symptoms from vitamin D deficiency. Obesity does not affect the capacity of the skin to produce vitamin D3, but might after the release of vitamin D3 from the skin into the circulation. Vitamin D can improve diabetes control, and it is recommended that vitamin D supplementation should be included in treatment of type 2 diabetes. The stronger interaction of 25 hydroxy vitamin D with obesity with regard to insulin resistance may be related to the direct impact of vitamin D deficiency on insulin resistance. Vitamin D supplementation results in a statistically significant decrease in body fat mass in obese diabetics. Vitamin D supplementation in overweight people reduces the risk of type 2 diabetes and improves insulin resistance. So here is the recommended dietary allowances, RDAs, for vitamin D. Here is the age group. age group from 0 to 12 months, 1 to 13 years, 14 to 18 years, and 19 to 50 years, 51 to 70 years, and greater than 70 years. Male and female pregnancy and lactation, how much quantity of dietary recommendation for vitamin D should be given for people. So you can see from this one. Vitamin D intake recommendations: obese children and adults on anticonvulsant medications, glucocorticoids, antifungals such as ketoconazole, and medications for AIDS be given at least 2 to 3 times more vitamin D for their age group to satisfy their body's vitamin D requirements. These people need more vitamin D than normal people. Food sources of vitamin D: multiple sources of vitamin D are also there. You can see from cod liver oil and international units per serving and percentage of the vitamin D. So cod liver oil, swallowed fish, multiple things, milk and liver, eggs, ready to eat cereal are given here. Sources and their international units of vitamin D presence in these foods, in these sources have been explained. So how we recommendations: increase consumption of foods that have been fortified with vitamin D. This is important. Sensible sun exposure limits. Vitamin D supplementation during the winter and in those who use sunblock during the summer should be checked. Assess vitamin D levels in the blood at annual checkups. This is very essential one. Thank you very much for your attention. Please subscribe, like and share this video for the other people to understand about vitamin D, importance of vitamin D in the body. Thank you very much. Allah Hafiz.